If your pancreas could speak, it would probably be screaming by now. But the tricky part is this. By the time you do hear it asking for help, it may already be too late. So today, I want to walk you through the exact approach gastroenterologists like myself used to protect our pancreas for decades. There's one strategy in particular that most experienced doctors didn't even know about until recently. But before I go further, let me ask you something that might feel a bit uncomfortable. When was the last time you consciously thought about your pancreas? Chances are you probably never have. And yet right now, as you're watching this, your pancreas is working non-stop, behind the scenes, to keep you alive and well. Now the real question is, how much longer can it keep doing that, if we continue to ignore it? Let me give you a sobering fact. Every 3 minutes, someone in the world develops a silent pancreatic disease. And right now, about 80% of people watching this video are unknowingly living with at least one active risk factor that's quietly harming their pancreas. Most have no idea it's even happening. Just 2 weeks ago, I received a message from Maria, 52 years old, from Barcelona. She wrote, "Doctor, I wish I had seen this kind of information 5 years ago. I've just been diagnosed with chronic pancreatitis, and my life has completely changed." And you know what's truly heartbreaking? Over 70% of these cases could have been prevented. But before I explain the protocol, one that truly could save your life, there's something fundamental you need to understand. Why is your pancreas so vulnerable? Why are the prevention methods you've been told all your life incomplete? And most importantly, why has conventional medicine been focused on the wrong things for decades? To truly protect your pancreas, you need to understand the role of this silent hero that lives inside you, your pancreas. It's like a conductor. But not just any conductor. Imagine someone leading 5 symphonies at once, every hour of every day, 365 days a year, without ever missing a beat. For example, the moment you take a bite of bread, your pancreas instantly jumps into action, producing at least 8 different digestive enzymes. Amylase to break down carbohydrates, lipase to handle fats, trypsin and chymotrypsin to break down proteins, and that's just the beginning. At the same time, your beta cells must measure the exact amount of glucose in your blood and release just the right amount of insulin to keep your body in perfect balance. But here's what makes your pancreas so unique. Unlike your liver, which can regenerate, or your heart, which can grow new blood pathways, your pancreas has no backup plan. When a pancreatic cell dies, it's gone for good. Now here's something modern medicine often fails to explain clearly. There's a process we call the silent cascade of the pancreas, and chances are that's exactly what brought you to this video. Let me walk you through what this means, because understanding this process may truly be the key to protecting your health. Step 1. Constant overload. Every time you eat something highly processed, every time your stress spikes, every night you don't sleep well, or every drink you take past moderation, your pancreas takes a direct hit. But here's the tricky part. It doesn't complain. It just works harder. Step 2. Microscopic inflammation. This is something that routine blood tests almost never catch. Your pancreas begins to swell, not in a way you can see or feel, but at the level of the tiny cells. The tissue becomes slightly inflamed. The ducts narrow, blood flow slows. You might notice this as a little bloating or some occasional heartburn, nothing that seems serious. Step 3. Silent scarring. Your body tries to heal the inflammation, but it ends up laying down scar tissue. Think of it like replacing flexible, healthy muscle with thick ropes. Over time, your pancreas becomes stiff, less adaptable, and gradually loses efficiency. Step 4. Progressive loss of function. This is when things start getting serious, though you might not notice anything just yet. You could be losing 1 to 3% of pancreatic function every year without even knowing it. That's because the pancreas has a huge backup capacity. You don't feel symptoms until it's already lost over 70% of its function. And then comes Step 5, the point of no return. One day, without any warning, your pancreas reaches its breaking point. Suddenly, you're dealing with severe abdominal pain, erratic digestion, wild blood sugar swings, and unexplained weight loss. At that point, for most people, it's already very, very late. Here's the part that frustrates me the most. This entire cascade, It can be stopped, and in many cases even partially reversed, at any stage before step 5. But you need to know exactly how. And if you're thinking right now, Dr. Amara, this sounds terrifying. Is there really anything I can do? Let me give you a resounding yes. Not only is there something you can do, but what I'm about to share with you has transformed the lives of patients around the world. Take Roberto, 58 years old. He reversed his prediabetes and cleared up his digestive issues in just 4 months. Or Carmen, 45 years old. After suffering for years with chronic abdominal discomfort, she now lives pain-free and fully functional. But let me be completely honest with you, what you're about to hear next. It's not magic. It's not pills. It's not expensive procedures. It's science. Applied intelligently. And it all starts when you make the conscious decision to take care of that silent hero that lives inside you. Are you ready to learn the protocol that's quietly transforming how we approach pancreatic health? Let's walk through the 6 core pillars of supporting and restoring your pancreas, based on modern evidence-backed strategies you likely haven't heard from your regular physician. Pillar 1: the pancreatic recovery window. Your pancreas, like any hardworking organ, needs time to rest and reset. And research shows it takes at least 14 hours without food for your pancreas to activate a natural repair process called autophagy, a built-in mechanism where damaged cells are cleared out and replaced. Now here's the key. It's not just when you eat, but how you break your fast that determines whether your pancreas heals or deteriorates. Here's the recommended structure. Your last meal should be at least 4 hours before bedtime. Your first meal the next day should follow this exact pattern. Lean protein about 20 grams, healthy omega-3 fats such as 1 tablespoon of extra virgin olive oil or a small handful of walnuts, non-starchy vegetables like spinach, zucchini, or broccoli. No refined carbs during the first 2 hours after breaking your fast. Why does this work? Because after a 14-hour fast, your pancreas becomes incredibly sensitive, ready to clear inflammation, reset insulin function, and recycle damaged tissue. Studies show this kind of protocol can improve insulin sensitivity by up to 40%. Pillar 2: the pancreatic anti-inflammatory formula. Now let's talk about nutrients. There are 4 key compounds that act like a molecular shield for your pancreas. Most doctors know them separately, but very few talk about the precise combination and timing that makes them truly effective. Nutrient number 1: curcumin with piperine. You'll need 500 mg of 95% standardized curcumin extract, plus 5 mg of piperine, black pepper extract. Take this 30 minutes before your main meal. Why? Piperine increases curcumin absorption by over 2,000%, and curcumin dramatically reduces inflammation in pancreatic tissue. Nutrient number 2: omega-3 EPA and DHA in a 3:2 ratio, 1,000 mg of EPA and 600 mg of DHA. Take with your highest fat meal of the day. This specific ratio helps reduce inflammatory markers associated with pancreatic damage by nearly 60%. Nutrient number 3: high bioavailability berberine, 500 mg 3 times a day. Take 15 minutes before each main meal. Berberine not only helps control blood sugar, it also protects the pancreas beta cells from oxidative stress. Nutrient number 4: magnesium glycinate. Take 200 mg at night right before bed, with a glass of warm water. Magnesium regulates over 300 enzymatic processes, many of which are crucial to pancreatic function and repair. Pillar 3: the ancient enzyme activator. This may surprise you. There's a practice that Buddhist monks have used for over 1,000 years that supports the pancreas by reducing its digestive burden by nearly 40%. It's called structured mindful chewing. And no, it's not just about chewing more times. It's about training your brain and body to work in harmony at the very first stage of digestion, the mouth. Here's how it works. First bite: chew 30 times slowly, focusing on flavor. Second bite: chew 25 times, imagining your pancreas being nourished. Third bite: chew 20 times, expressing gratitude to your body. Why does this help? Because digestion begins in your mouth, not your stomach. Each mindful chew activates neural signals to your pancreas, preparing it gradually instead of overwhelming it with a flood of unprocessed food. It also stimulates the vagus nerve, which enhances your overall digestion.